The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to our second Wellness Wednesday. This is Bob Boone, President and CEO of the Medical Fitness Association. We're glad that you're here today. And kids, I just tell you, hang on to your hats because we've got a lot of information for you today. But before we do that, Paul is with the Power Wellness Company, and he's going to lead the agenda for us today. And we look forward to the discussion that will come out of this. So Paul, take it away.
Thanks, Bob. Really appreciate the opportunity to participate in the Wellness Wednesdays, and thank you everyone for joining us this Wednesday afternoon. My name's Paul Prather. I'm the Vice President of Business Development with Power Wellness. For those that may not know, Power Wellness is fitness management and medical fitness, an institutional management company. We work across the country and obviously work a lot with the Medical Fitness Association and Bob Boone. And, we're here to help facilitate and create some community for our brothers and sisters in the medical fitness field around the country. Let everyone know, we're in this together. No one has all the answers at one point in time, and sharing information and knowledge is the only way we're going to be able to all make it through this. And so, we took this opportunity as a way to help create some relationships, hopefully provide some help and assistance, and also learn from the other best practices and providers out in the field. So please don't take this as we feel like we have all the answers or all the solutions, because we don't. But we're just honored and privileged to be able to speak with you all today. We're going to talk about some member engagement strategies, as well as hopefully some, how can you help mitigate some of the cancellations that y'all might be seeing and keeping members in line for when you are ready to reopen. So I'm going to introduce Josh Carlson, who's our Vice President of Operations, and he's going to kind of tell you about our speaker today. So thank you all very much, and I hope you enjoy the conversation. Josh?
Thank you, Paul. Again, just wanted to thank Bob and Marianne and Jason from the MFA for reaching out to us over the weekend and lining up these Wellness Wednesdays to share some best practices as a family. So last week was our first session. We had Jeff Duran, the Center Director from our Valley Health Facility in Winchester, Virginia, and he shared what he's doing at his center, why they're closed, with a lot of facility upgrades, repairs and maintenance. So thanks again for Jeff for being our keynote speaker last week. And then this week, again, week 2, we have Eric Kepper, who is our Director of Sales, has over 23 years of experience in the sales fitness industry. And today, like I said, we're all in this together, tried to pick the most positive speaker probably in our company that can, again, share some best practices about members and have a productive, positive call today. So without further ado, Mr. Eric Kepper, Director of Sales.
Thank you so much, Josh. And thanks, Bob and Marianne, for coordinating this. And thank you for everybody who is taking the time today to log in. Josh put a little pressure on making it upbeat. So hopefully you get something upbeat and really worth value out of the conversation. We know that this is really challenging times. I don't even have to say that. And in my 23 years in the industry, I don't think I've ever seen anything like this. But something else that I haven't 23 years in the industry is just the collaboration that fitness centers, people who love this industry, have shown in coming together so that we can make it through to the other side and be better for it. And it's really, really inspiring. So I know that some of you had submitted some questions ahead of time, and I really appreciate all of you who did that. And I get that all of us are looking for answers. We want to know, what is the right move right now? How do I engage my members? How do I pay my bills? How do I do this? What about this? And as Paul said, the truth is there are no right answers. There's no silver bullet. It's really going to vary by your center. But today, what we're going to focus on is, I thought we would talk about how to engage your members during this challenging time. So I'm going to share a little bit of data. and talk through a few different strategies, what we have seen in the industry and some of which we've tried, and then we'll open it up to conversation, to either questions or best practices that you might have in your member engagement. So, all of us right now, we're looking at how do we engage our members and maybe even potential members, and why would we even look at that? Well, what's crucial is that how you engage your members now is going to dictate the probability in which they come back to the center. So there was some data out there that I pulled that if you were to stratify your member base, if you look, you have a certain percentage of your members that were working out, let's call it 8 to 12 times a month. And those people, by that habit that they're committed, they're in a routine. So what's predictable is that when they're at home right now, they're not sitting on the sofa watching Netflix 12 hours a day. They're actually continuing with their workout routine, whether that's in the park, whether that's online, whether it's in their home on their own, they're continuing it. And what's also predictable from that is that they're going to come back. They're raring to come back, and as soon as we give them the green light, they're going to be first in line to come back into the center. Now, if you think to your own fitness center, and you think to what percentage of my members are that member who are going to be raring to come back and who are holding it all together and moving it forward on their own, it's probably not a big percentage. It might be 15%, it might be 20, it might be 25 top. Then you think about everybody else who have checked in 0 times to maybe 5 or 6 times a month. And if you think to where those people are today, they might be sitting on their sofa watching Netflix. They might be reaching for the snack drawer multiple times a day. I mean, Lord knows I'm going to the snack drawer regularly while I'm at home. And what's very, very probable is that those people are going to fall off the fitness wagon. And I know that each and every one of us on this call, we're really committed to continuing to make this positive contribution to our members' health and well-being, which also, let's face it, it ties directly to the financial success of our fitness center. So we want to talk about the strategy. How can we connect with those people in a way that's meaningful and is going to keep them engaged and have them return to the fitness center? So first off is there is no general message for everybody that's going to be effective. So what I would say is, depending on the size of your center and how many centers you deal with, whenever possible, customize your messaging. Your message to the person who works out 12 times a month. We got a little bit of background noise from somebody. So your messaging to the person who works out 12 times a month is going to be much, much different than the person who works out once a month or hasn't shown up at all. So you want to be really customized in your messaging. 2 is you don't want to overwhelm your client with messaging, because there is a lot of messaging going on right now. I mean, between all of the social media posts and all of the CNN updates and everything else, our members are overstimulated with messaging. So you want to try and make your messaging, pick a cadence that's not too frequent, and be really clear and purposeful with your messaging, right? So sending a message that doesn't have a specific impactful purpose, like, hey, I don't know, like, did you see this? Or it might not be the right message. For example, with your billing, I know a lot of you are concerned about billing practices. Don't have a specific answer on how to bill, but when you decide quickly and decide and stick to it and get that message out to your members. In fact, what we've seen is that the quicker you can get a decisive message out to your members, the more likely they are to not term their membership and not bridge or freeze. Because if you were a member and you got a message from us saying, hey, we know you're stressed right now, and we don't want to give you one more thing to worry about, so we've got your back. we're suspending your billing for the month of April, and we won't bill you again until when we open, if that's what you chose to do. Well, then they don't have any reason to come to you and say, I want to term my membership, I'm concerned, or I need to bridge or freeze. We've already.
And have we lost Eric altogether?
I don't know. While we're waiting on them, do you want me to start covering those couple of things I'm going to cover at the end?
Yes, go right ahead.
Okay. Well, we apologize for the technical difficulties we're having with our panel. We're waiting on them to get back. Let me go ahead and cover a couple of things that I wanted to touch base with you about, because a lot of people are asking about it. The first thing I want to do is thank all of you who participated in our letter writing campaign last week before the passage of the stimulus bill. It was helpful, and they did include a number of the provisions we were asking them to include, so that was most helpful. Many of you have been asking about the disaster relief package, particularly the payroll protection loans that are available to the Small Business Administration. Those are really important and big, and we will be putting a link on our website after the webinar today that has the actual payroll protection application attached, as well as a couple of 2 or 3 page PDF that goes through the bill and explains what each of the different provisions in the bill are, so you can understand which, and also has links, so you can decide which, if any, loans you're, one, eligible for, and two, whether or not it helps you decide whether you're looking for a payroll protection loan or a debt relief loan. And you can apply for both. So I think it's important that we become aware of those, and we'll talk more about those provisions a little bit later, perhaps next week. But if you're interested in the payroll protection loans, it is going to be on a first come, first served basis, and applications will be starting to receive by banks who can process what the SBA calls 7A loans. And if you, the applications will be received starting April the 3rd. So Friday is the first day that banks will accept these. So if you're going to do that, going to apply for those, since it is first come, first served, you may want to make sure to get those in Friday. There's some additional links that from the Small Business Administration to give you more information, and throughout their website, as well as one of the groups we work with called the Independent Sector, which is an association of nonprofits that provides some additional explanation of these things. So for many of you, this can be an important way to protect your payroll. The nice thing about the payroll protection loan is that if you do not lay anybody off between now and the end of June, that loan will be forgiven. And that's what's kind of exciting about it. It's a way to keep people employed, find things for them to do, and then still not have it be a total drain on your business. Secondly, there's another really important piece that I just kind of stumbled upon yesterday when talking with some members who are doing some kind of innovative things. I know one of the questions says, what can we do to generate some revenue during this downtime? I want to hark back to the heart of who we are. What we tell people is that we are positioned as a part of the healthcare continuum in what we do, and that we focus on, in our primary purpose, even though we see and work with members of every stripe, but our core purpose is to help people who are chronically ill and injured, and to work with those folks. So we have at least 2 facilities of which I'm aware that have petitioned their state to be declared an essential business for their medically referred programs, and they've both been successful. And so they're staying open. They are honoring certainly all the cleanliness and all the sanitation pieces, and they're maintaining physical distancing, but they are still running classes for their chronically ill members, and seeing in their exercises medicine program, they're seeing individuals and small groups, as long as they maintain distance. So that's another option for people if you want to think about this, since it looks like this might be a prolonged shutdown. The best information that I have from the CDC as of yesterday is that we are looking at about probably a 8 to 12 week shutdown period for most of the country. And so in the meantime, if there's things that we can do to at least partially ramp up our business, that has a lot of ramifications down the road for holding ourselves out as truly being different than our commercial partners, and that we truly are part of the medical system, medical care system. There'd be there's a lot of side ramifications to that down the road. So I encourage anyone who's interested in trying to figure out a way to stay at least partially ramped up to take a look at that and see whether or not it makes sense for you to apply at your state level to be considered an essential business for your medically referred programs.
Bob, this is Jason from MFA. I believe I've been told we have a panelist back.
Oh, good. That's perfect. So I was just finishing covering what I was talking about. So if we have Paul back or whoever's going to be
Muted.
I'm glad.
Hello.
Hi, is this Josh?
Well, this is Eric.
Oh, hey, Eric, you're back.
Oh, fantastic.
Oh my God, I am so sorry, everyone.
Oh, that's okay. Look, this is, we're all working in a different way that we're not used to, so not a problem.
Oh my God.
Yeah, that was like the longest pause ever to keep everybody in suspense.
I know, and everybody who is still with us, thank you so much. All right,
So Marianne, where did I fade out? What were we? The last thing I remember saying was we were talking about the different types of members you have, the really engaged members, and customizing your messaging. Was there anything after that?
No, that was where you cut out.
Okay, good. Well, not good, but okay. All right. So what we were creating was really customizing your messaging. Like for example, we've all become online video experts at this point. Every fitness center, whether it's commercial or medically based, is creating online content and pumping that out as quickly as possible to engage with members. Well, you could take it a step further and you could customize it. So if you know, for example, that your Tuesday and Saturday yoga class with Janelle is the most popular yoga class out there, then you could plan on hosting that class or making it available online on Tuesdays and on Thursdays at the same time, because your members are used to certain routines. So the more we can get them connected to that routine and give them the experience that they are still an active member, the more it's going to be less of a transition when they come back. So when you're creating your online content, creating the classes that you know that your clients like, that your members like. So looking at your class check-ins and seeing who's got the most popular, and then also maybe highlighting. So you might highlight if your population that is more limited in motion, right? So they're more used to like a chair yoga. Maybe you're able to market it directly to them that, hey, this class, we want to make it available to you because we know that you're used to doing that. So, really calling that out. Give your community as much structure as you can. So, one way that you could create some structure is you could create like a movement challenge. So you could look at, hey, over the next month, we're going to encourage you to move as much as possible, and we're going to send you follow-ups on a weekly basis with wellness tips like today's activity, or this week, vacuum the whole house. That's your 30 minutes of activity, or clean out the garage, or take the dog for a walk, or push some online content at that time and say, here's where you can go. So you're giving them a reason to engage with the programming that you're sending out, and then create some kind of incentive at the end where if they move a certain amount of minutes over the next 5 weeks or 4 weeks, when we reopen, you can bring your tracking into us and be entered to win some kind of prize. So really putting some structure in and encouraging them along the way without bombarding them with information. Now, I know I did hear Bob when he was talking about revenue. I know that some centers and some providers have looked at their one-on-one clients. So we know that our one-on-one clients are highly engaged members and they're willing to pay for additional services. So maybe creating virtual coaching, personal training via Skype or via GoToMeeting or via Zoom. And you don't have to charge less for it. You can still charge your full rate. However, one of the recommendations that's been made is that if you are going to do that, shorten it, because if they're used to training 60 minutes, training 60 minutes online is like creating 3 days worth of materials. It's very challenging. So bring your 60-minute clients maybe down to 30 minutes, but charge them the same per minute. So the total is going to be less, but the per minute rate is going to be the same. And then you can generate a little bit of revenue. If you do have the human power, go ahead and create a call drive. I know there's a fantastic example of a center out there that has a hospital partner, and they use the fitness center staff to actually call patients in the hospital and just check in on them. But you know, we know that in the medically integrated fitness centers, the average age of one of our members is a little bit older than in the commercial fitness centers, and those are the folks that are really at risk with this coronavirus, the older clientele. So they're out there and they're scared and they're not sure what to do. So maybe if you have the human power, just calling them and saying, hey, wanted to check in. How you doing? You know, it's been a while since we saw you and we know we're closed. Are you keeping active? Let me give you a recommendation. Walking around the block a few times for 20 minutes a day is going to impact your positivity. It's going to get your heart rate up. It's going to boost your immune system. So being able to engage with people like that, and we've heard some fantastic feedback from members that we've done that with. And then everything that you're creating, you can also include your future members. So we know that marketing and sales, it's really at this point, it's inappropriate to go out to the public and say, hey, you should join us right now because. But being able to provide value to everybody who's connected with your center 90 days prior to this and say, hey, we're having a movement challenge. We know you're not a member, and that's okay. We want you to be included because it's important that you keep moving right now. It's important for your own mental health. It's important for your physical health. So join us, and you know, there's really no strings attached to it. That's going to do a couple things. One is we feel great about that, right? Because why we're in this business is because we want to contribute to the health and well-being of everybody. But two is when we come out of this and that person is not attached to a center already, who do you think is going to be the first person they call when centers are back online? You know, they were a part of your movement challenge. So it's a great opportunity. So those are just a few ideas, and I don't know how many of you are still on the webinar, but I would love to open up the conversation at this point to either questions about how to engage members, challenges you're up against, or share some best practices, things that you've seen that your members have really appreciated or has kept you engaged with your members. So I'll open it up to questions or to best practices.
And Eric, we do have a couple of questions that I had sent out to you guys earlier, and I put them up on the screen now that people have asked about. One of them was how facility leaders are keeping their employees engaged at this time too.
Yeah, it's a great question. You know, there's a lot of people in the industry who are laid off at this point. And as much as we work for our clients and we work for our members, we also work for our employees. And treating our employees the same way we would treat a member, checking in on them, offering them words of wisdom, pointing them to any resources that are out there. You know, your employee might just be frozen in, wow, applying for unemployment insurance really seems like a daunting task. I don't know the first step to take. Taking that personalized approach and calling them and saying, hey, let me help you through these steps. Or, you know, sending them the wellness challenge and saying, hey, it's important that you take care of your physical health. Really treating them the same way you would treat your members is just so critical, because, you know, when we open up, we know that our staff is the backbone of our fitness center, and, you know, they're the most important part about servicing our members.
Thank you for that, Eric. You know, one of the other questions was, you know, even when they do finally reopen, you know, kind of given that lingering fear that people are anticipating, how can they help members get back into the swing of things once they do reopen?
Yeah, it's a great question. And I think it's a question on all of our minds. So part of it is, again, how you engage them right now. So if they know that you've gone the extra mile to personally look out for their best interest, their health and wellness, and you've provided them with structure where they still feel like they're part of the community and they're still improving on their health and wellness, they're more likely to come in. And then, you know, it's still too early to tell, right? We don't know if when centers reopen, if there's going to be limitations we're opening into. But, you know, I would anticipate one of the things that really is going to be on the forefront of people's mind is this clean environment and how we're playing into this new world with the risk. So being able to communicate how your center is accounting for that, whether it's, you know, limiting the number of people that are in your center or talking about your cleaning schedule or whatever it is, letting people know it's safe to come in. That's going to be really critical. But I think we'll know more about that as we get further along in this and see what it looks like when we get there.
Thank you.
Mm-hmm. Yeah, and I'd love to hear from some of the other centers, Marianne, just on what they've been doing or what they see has been working in terms of communication with their clients, with their members, and keeping them engaged.
Sure. I know one of the people that I talked to yesterday, who wasn't able to make the call today, she, at her center, they just sent out a bingo card, and it has different things that you can do every day. And they did one for adults and one for children. And it had everything from, like, on the children's one, like, take this time to clean your room, which when my kids were little, that would have been awesome. You know, to different nutrition things, to different exercise things. And they had over 200 people sign up in the first 24 hours.
Yeah.
So I think
yeah, that's fantastic.
They really are looking for things.
Yeah. What I love about that, Marianne, is that center went above and beyond sending out just online material. Because there's so much free online classes right now, and that's great to point our members to that, but customizing that inside of a bigger game, if you will, like that center that you just talked about, right? So they created this bingo card, and part of that might be, you know, here's some online resources, online classes, and part of it is what you can do around your house, and part of it might be just practice smiling once a day, right? Just general health and wellness. But you're right, people want to be engaged right now. They're you know, fitness center for a lot of our clients is such a huge part of their life and who they are. And right now that's missing for them. So any way to connect with them and create that community is a win.
Right. So now another one of the questions was you know, this, as I would say, most, if not all, of the closed centers have frozen their membership, so their revenue is zero. Are there any other ideas to generate revenue? This person said maybe personal training by appointment only. Are there any other ideas?
Yeah. I mean, I'd love to hear from the group here on this call, what they've come up with. I mean, clearly we can do virtual training. You know, I have a lot of friends in the industry and they've had to shift gears and they're doing virtual coaching, virtual training, and that's generating some revenue for them. You know, there's the idea that you can give free online content, but then you could create premium online content and actually charge a monthly rate for it. So I know my wife participated in an online Pilates mat class that had 10 other participants in it via Zoom. And the person who's coordinating that already had a following, and she charged $10 per class. And it was an hour-long class, and there was 10 people, and she watched you through the camera on your computer and gave you, you know, called out, hey, Wendy, that's great. You know, I know you have an issue with your back. Why don't you put your feet on the ground for this? So you figure that's a little bit of revenue that she was able to generate through that.
Right. Well, thank you for that.
Sure.
Somebody else had asked the question if
Marianne, before you leave that one,
yeah.
if you don't mind, I'd like to address a couple of things that I've heard too.
Sure.
From talking with some of the members. I've seen a few centers bring back an old idea that was tried in the early 90s, is that they've created in the short term an at-home membership, and they're charging like $20 a month. And for that, they're putting together an exercise program for those people at home, and they're being called by a personal trainer or by a health coach, or they're not a health coach, excuse me, but they're being called by an exercise professional every other week. So 2 calls per month to check in and to modify and to, you know, to help. And then a couple of people have also put together for that some stretch bands and other exercise equipment that they can sell through their pro shop or online and make a little revenue just from the sale of that at-home equipment as another way to stay engaged, and also as a way to be out there and be a part of your members' lives at home.
Yeah, that's great. For those centers that are connected to MyZone, I know MyZone is doing a global challenge right now, where if you're a MyZone user, you can enter to win, and you earn a certain amount of exercise points, and you're entered automatically to win, and they're giving away like $5,000 to the winner, which is incredible. And your center, if you are a MyZone user, actually gets small commissions on selling the boats and selling the belts, not the boats. And MyZone will actually ship the belt directly to the client, cutting you out of the equation, so you don't have to worry about the distribution. And then that person is still connected to your center because they use your center code to activate. So when they come back, they're already connected to your center and in your programming.
That's great. The one other practice I've heard of, I'm not sure I'm in favor of it, but I have heard of it, is that some people are sending personal trainers out into people's homes and doing at-home personal training. I think that's a little risky, but it is a practice that some people are doing and helping maintain some income.
So another one of the questions we had is that a lot of facilities have converted entirely or partially into childcare for the hospital employees. Eric, have your centers had any experience with this?
You know, I really could not answer that question with any authority. Sorry, Marianne.
Yep, nope.
But it's a great question. It's a great question. And those centers that are doing it, you know, kudos to them for helping that frontline staff.
Yeah, I know of one facility that's converted their entire facility into a childcare facility for hospital staff's kids. They have, I think, around a 50,000 square foot facility, and they are keeping upwards of 200 kids a day, and keeping them all physically distanced and doing appropriate things with them has been a challenge, to say the least. And there's other issues with doing childcare like that. If you're providing childcare for more than 2 hours a day, then you fall under the state daycare licensure rules. which I'm sure they're doing some things to waive right this minute or just turning the other way. But I'm concerned if we do that, what kind of training is the staff getting for managing kids, and are they being supervised by a professional daycare staff if that's the case? And how many kids are being allowed, and how are you maintaining the physical distancing, for the people that are in the care at that point in time? So a lot of issues around it, but there are people successfully doing it. I've heard of 5 or 6 centers around that are doing either all or partial childcare.
So somebody else had asked the question, Bob, when you mentioned earlier that the shutdown could be 8 to 12 weeks, and do we have a projected end date? And I know we've got a question from somebody in Virginia who said that Virginia's state stay-at-home date is now June 10th. We don't really have a sense of what the projected end date is at this point, do we?
No, I mean, CDC has only put out guidance that they say it's going to last about 12 to 16 weeks in any particular locality, depending on how well people practice the good personal hygiene and physical distancing and all that kind of good stuff.
Right.
The encouraging piece is, as I mentioned to some people yesterday, and I heard a news report, actually it was yesterday, I heard it, that Wuhan, China, where this whole thing originated, has now reopened their retail shops. And given the fact that it was around January the 5th or the 6th that the first reported case came about in Wuhan, so we're now roughly 14 weeks past that. And so, around 16 weeks is kind of what CDC is projecting for the length of this thing to last, at least this go round. It's a chance it'll come back in the fall, but for right now, from the time it starts in your community to the time you're virtually back to normal should be in the neighborhood of 16 weeks. And so that's kind of what we're basing our opinions on, and Virginia may have it right. I mean, I think given where it started kind of on the East Coast here, 14, 16 weeks puts us in the middle of June. So that's probably going to be closer to right than anything else I've heard at this point in time.
Okay. And one of the questions we had was discuss ways to gain income when losing revenue. And the question mentioned business interruption insurance. And we will be posting the audio to this call today on our website and for every Wellness Wednesday call going forward. And we'll include some resources for that sort of information.
Yeah, on the business interruption insurance, I think you have to just be really careful. If you just bought general business interruption insurance, it probably will not cover an act of God, which is COVID-19. So there have to be specific clauses. It might not be a bad idea, and I think I said this last week in the advocacy letter information we sent out about contacting your state. I believe that one of the provisions that some state legislatures are looking at is requiring insurers to cover this under business interruption insurance. So if you're in contact with your state legislators, that's a good thing to ask them to consider going forward as part of the stimulus package and part of the relief package for COVID-19. I'm sure the government would be in favor of that because it would save the government money if some of these claims could be paid under business interruption as opposed to small business loans.
Okay, thank you for that. And it doesn't look like we have any other questions right now. So does anybody, any of our panelists want to say anything to wrap up?
So Marianne and Bob, thank you so much for putting this together. And technical glitches or not, it's really great that all of us have the opportunity to come together and share some best practices. And I know next week, one of the topics that we were going to start to look at was looking ahead to that reopening. And I think between now and then, something to think about is just that we might have to reimagine our whole fitness center right? Because we don't know the kind of restrictions we might open up under, and it's going to be something that's going to be an opportunity to wow our members with certain restrictions. And again, however you communicate with your members now and engage them, if you keep them engaged, they will be loyal and waiting to come back when we open under whatever circumstances it is.
Yeah, I agree. I want to thank everybody for being here today, and in spite of the technical glitches, for hanging on with us. We encourage you strongly to send your questions in that we can ask the panelists to address next week, and that may, depending on what comes in, that may be our focus next week, is to focus on your questions and helping you through some of the steps. Do watch the MFA website. We'll have information going up later this afternoon with a recorded version of today's program and the links that we've talked about to the small business loans and the some other information around COVID-19 impact and resources to help us through this crisis. So let us know how we can support you as an association. We are your association and we're here for you. So anything that we can do to assist, or if you have questions that we can send out in survey form and find out what others are doing, you know, and then share that information with you as members, we're happy to do so. And we just wish everybody the opportunity to stay well, stay safe, and be innovative. There is an opportunity amongst all the downside of all of this if we just use our imaginations, and as our panelists have all emphasized today, staying engaged with our members, staying engaged with our staff, and helping our staff members survive this as well as they can. I'm going to diverge just a second because it just came to my mind. I had read a question sometime earlier today asking about unemployment for staff members and those that have been laid off or furloughed. A best practice that I saw, actually, I think would be very helpful if you have had to lay off staff members. If you could prepare for them a one-page information sheet that gives their dates of employment, that gives information about who to contact in your local community or the state website where they can apply for unemployment, and give them a little bit of assistance and a leg up, and give them some information that they need, up to and including on this sheet saying that they were laid off based on the COVID-19 virus and not due to any work performance. They can actually submit that documentation to the state, and it makes it a lot easier for the state then to approve unemployment with the additional $600 per week, that they'll eventually get from the feds, knowing that it's only COVID-19 related, not anything otherwise employment related. So I may. I have a couple of examples of employers that have done that, and so I may white out the names of all involved and post something like that on the website as well, so we can show an example of what that letter might look like. But that's kind of best practice that I've seen that I think would be another way of showing your employees that, while you don't have work for them right now, you are concerned about them and you want to make sure they're taken care of.
Okay.
So Marianne, I think that's it.
All right. Well, thank you, everyone. We will be back next Wednesday, hopefully without the technological problems. But I want to thank you all for joining us today. And you can always email me at mariannemurphy@medicalfitness.org to ask any questions or make any inquiries about Wellness Wednesday. And thank you for joining us.